Okay, so, and you'll note that I got a different mask. Okay, so I'm going to do my drug pass, my med pass checkoff. I'm going to do hand hygiene. I'm going to look at my MAR. I'll see that my patient, Mr. Rodriguez, has got some meds coming up at 9 o'clock. I've been in to see her already this morning. I did my head to toe. Her assessment's pretty negative. Her vital signs within normal limits. And she's getting ready to be discharged later today. I know she ordered her breakfast. The breakfast tray is on its way. So I'm gonna go in, I'll knock, I'll say, hi, I'm Rick, I'm your Bethlehem nursing student, provide for privacy, do hand hygiene. I said, how are you this morning? And she says she's fine. And I'm gonna set up the head of her bed. We'll put the head of your bed up, ma'am. And because I'm gonna be getting your pills and your breakfast is coming. And she says, oh, good. Say, I know I was just in to see it, but could you remind you your name? And she says, my name is Adrian Rodriguez. I'll say, all right, Miss Rodriguez, remind me your birthday. And she says, it's 2/12/57. I said, okay, thank you. So I'm gonna get your meds for you. Your breakfast is coming. As you might remember, some of your pills, it's good for you to have something in your stomach so you get less of an upset stomach. So when your breakfast arrives, while I'm getting your pills, why don't you start eating your breakfast, okay? And she says, okay. I'll say, can you remind me, what do you like to take your pills with? And she says, I'll take them with my orange juice, or I'll take them with water, or whatever she wants. So, okay, orange juice. Okay, I'll be right back. Do hand hygiene. Come out to the table, I clean it off. I guess do hand hygiene again. And then I'm gonna retrieve the drawer. If it's not already out here, I'll retrieve the drawer from back at the med cart, but this one's already here for me, and I'm out in the hallway. So I'm gonna start doing my 3 checks, and my instructor asked me, what are you gonna be checking 3 times? And I'll say, I'll be checking my 5 rights. What are your 5 rights? Right patient, right drug, right route, right time, right dose. And you're gonna check them 3 times where? And I'll say, I'll check them twice out here in the med cart, where I retrieve the meds, and then once at the bedside before administering. And my instructor starts crying. She starts weeping. She's so happy. And I say, well, please, please, please. It's just because Mr. Becker taught me. That's why. That's why I'm so good at this. Okay, and then I'm going to start doing my first check. So I'm going to see at 0900. So I got it right. Oh, first of all, it's right name, Adrian Rodriguez. I'm going to look. The first drug is ferrous sulfate, 325. So I'm going to look. I'm looking. Ferrous sulfate. Okay, I'm gonna look in here. Here is, okay, ferrous sulfate, 325, orally, once a day. So I got the right drug, the right route, right time, right dose. Time, and the time includes both the day and the time, the clock time. So I'm gonna look over here on the 7th, hasn't been given yet. So I'm gonna just lay it right there, okay? So then I see furosemide, 20 milligrams, 0900, so it's the right time because of sorry, I should have said the time of the clock is 8:30. And I know that I have an hour leeway in either direction on 9 o'clock. So it's okay for me to go give her these 9 o'clock meds, even though it's not 9 o'clock yet. Okay, so I'm looking, furosemide. Here we go. Furosemide, 20 milligrams. On the 7th, hasn't been given. I'm just gonna plop it right down there for my first check. Then potassium chloride, and I remember seeing the potassium chlorides on this card. So I'm going to look at it. It's 10 MEQs, 2 tablets twice a day, okay? So if this is the right drug, right dose, right time, I'm gonna plop it down there. Then the metoprolol, I'm looking for it. Okay, metoprolol, 0900, right time, 25 milligrams twice a day, hasn't been given on the 7th, plop it down. Then the nitroderm patch, in the bag here. And it says 0.3 milligrams an hour, applying AM, remove at HS. So I'm going to make note of where the nurse charted that she had put it on yesterday, and I will make sure that it is off before I apply a new one, just to double check. And I know that nurse that did that yesterday, so I was just not fibbing. So, but I still have to double check for me, for my patient's sake. So I look across on the 7th, hasn't been given yet, okay? So that's my first check. All right, now I'm gonna go back through and I will do a second check. I'll start from the top. And it's always safer to start from, it's best to start from the top and go to the bottom, just because that way you're less likely to miss something. Okay, so ferrous sulfate, hasn't been given yet on the 7th, 325, 1 tablet once a day. Okay, good. And it's an individual package, so I can open it at the bedside, okay? And I'll just put it in there for now. Okay, and I know my instructor says, why are you gonna be giving her ferrous sulfate? And I know that it's iron, because I know she has iron deficiency anemia, so I know it's indicated, it's appropriate, okay? I also know that iron can cause upset stomach, which is why I encouraged her to start eating when her breakfast arrives, because it'll make it less likely she'll have indigestion with this pill if she has something on her stomach. Okay, so furosemide, 20 milligrams, 0900. All right, 1 tablet orally twice a day, hasn't been given yet. This is known as a water pill. This is going to draw fluid away from her edema or from her heart and dump it out through her kidneys. And I know that it also can cause low potassium, but I can see here that she's also on a potassium supplement. And I could check her labs for her potassium levels if she had any, okay? And I'll make mental note that I'll have to go in and help her up to the toilet in about a half an hour or so, because she'll have to go. All right, then the potassium chloride, 10 MEQs, 2 tabs, so it's a total of 20. Hasn't been given yet. Okay, and this card, these tabs are 10 MEQ each, so I'm going to give her 2 tabs. And because this is a multi-dose package, I'm going to pop them out now into the container. All right, and I'll use the highest number on the card. I'll go right up to the card and pop it in. Oops. There we go, it's a clean table. I cleaned it off before I started. There we go. Okay, so that's her 2 potassium pills. All right. Then I've got her metoprolol. This is her blood pressure pill. It's an LOL at the end, so it's a beta blocker. I know it also is going to reduce her blood pressure, probably reduce her heart rate as well. I just took her vital signs a little while ago. Her vital signs are, her heart rate was 80 and her blood pressure was, say, 118 over 60, 64, something like that. So I know she's doing well. It's not too low. Okay, and it's probably her blood pressure is so good because she does take these pills every day. Okay, so I'm looking at 7th hasn't been given yet. It's the right dose, right time, right drug. I know it's indicated for her, appropriate. All right, and then finally the nitroderm patch. It's the right dose, 0.3 milligrams an hour. On the 7th, hasn't been administered yet. Right, it's going to be, and I'm going to make sure that the old one is off. Okay, so I'm going to put this drawer away. This cart out in the hallway is going to magically transform into a bedside table. Okay, I come in, provide for privacy, hand hygiene, say, hi, it's Rick again, can you remind me your name? And she says, how many times do I have to tell you my name, honey? And I said, oh, well, you know how we are. And she says, Adrian Rodriguez. She gives me her birth date. And I see her birth date and her name match up to the MAR. I'm gonna bring the MAR right to the bedside. I said, are you having your breakfast? And she said, yes. I said, tell me how you like to take your pills. Do you take them all at once or one at a time? And she says, I'm an old Marine. I choke them all down at once. I say, wow, you're tougher than me. Okay, so I'm gonna do my 3rd check. So I've got ferrous sulfate, I'm gonna tell her what I'm giving her while I'm going. On the 7th, has been given. This is your iron pill. This is for your anemia. She says, okay, honey. All right, has been given, the right drug, right dose, right time, right route. I'm gonna pop it in there. I did hand hygiene, didn't I? Okay. All right, I got your furosemide, that's your water pill, your Lasix, and she goes, oh, well, I know about that one. I said, I'll bet you do. I'll be back in about half an hour to help you up to the toilet. And okay, has been given on the 7th, 20 milligrams furosemide, orally twice a day. Okay, I'm going to open it again, just right into the cup. Okay. And then I got her potassium chloride is already in there, 2 of them for a total of 20 milliequivalents. Hasn't been given on the 7th. You take the potassium because you take the Lasix, and she goes, oh yeah, my doctor explained that to me. And okay, so they're already in there. I got her metoprolol, so your blood pressure med. Now she doesn't need to know it's a beta blocker. She just needs to know it's for blood pressure, okay? And I know I already got a good blood pressure and pulse on her earlier, so I'm gonna look at it, 25 milligrams on the 7th, hasn't been given. Okay, so I'm gonna open it up. It goes in the cup, good. And then the nitroderm patch, 0.3 hasn't been given. Okay, and I'm going to open it up. It's got a covering on the back, so I don't need gloves yet. And I'm going to write on it RB 9720 at 0900. Okay, and I'll just leave it there. All right. So now I can, I opened some of these pills out at the cart and some of them in here. So let's just, kind of on this final part of my 3rd check, I'm gonna count. Okay, I'm gonna count. How many should I have? I should have 1, 2, 3, 4, 5 pills in a patch. And I look and I got 1, 2, 3, 4, 5 pills in a patch. So that's a moral assurance that I mean, this is the right pills for this patient at this time. Okay? Do you have any questions about your meds? And she says no. Can you remind me, it says here you don't have any allergies. Is that accurate as far as you know? And she says yes. Okay, so, and she told me she takes them all at once. So she has her orange juice. I'll say, you ready? She says, yeah. She pour them in her mouth. She swallows them. She drinks her orange juice. She just poured orange juice all over herself. And she drinks them, and I ask that she swallows. I look inside with my little flashlight. I don't see any pocketing. I said, they go down? She said, yes, they did, honey. I say, okay, good. Let's get that patch on you, too. And I'm gonna look. You don't see this. It's like, oh, look over there. Okay. I look, and there's no patch anywhere. That nurse the night before certainly was diligent in removing that patch from the previous day. And I'm coming over here, putting on my gloves to protect me. She says, why am I taking, what's this patch for again? And I say, oh, this is the patch that's gonna help with your angina, your chest pain. She goes, oh yeah. Right, so I'm going to find a clean place without any hair, without any lesions or anything. And I'll say that we clean this off with soap and water, not with an alcohol swab, because we don't want to dry out the skin. It's clean and dry. And I'm just going to put it on there. And I'm going to hold it with my hand, help it adhere for about 10 seconds, I think the book says. And that's good. All right. And I said, is there anything else I can get you? And she says, no. I say, okay, well, I'll be back to check on you later. Let's just put on your call light if you need anything. And she says, okay. I do hand hygiene, come out into the hallway, and I'm gonna chart. And I chart by putting my initials in the box that matches the time, 0900, with the date. So RB, I gave this, the potassium chloride, RB, gave the metoprolol, RB, and then the nitroderm, RB, and I will put a site, because it's a topical med, and it's right upper arm, so I'm gonna put RUA underneath my initials for right upper arm. And then I'll make sure I attach my initials and my signature on the back, including my title, which is Student Nurse, Bethel University, SNBU. And then my instructor says, that was beautiful. And she starts to applaud, and then I get embarrassed, and I tell her to stop. It's just too embarrassing, okay? And that's your MedPass checkoff.